Hi everyone, my name is Josephine Ni. In this video, we will discuss what the DASH diet is and its effects on obesity and the leptin hormone. Before we do so, let's discuss what obesity is. I'm sure many of you have heard of this term before, but for the sake of this video, we're going to dive a little deeper on its definition. According to this article, Definitions, Classification, and Epidemiology of Obesity by Jonathan Pernell, who is a professor of medicine in the Oregon Health and Science University Knight Cardiovascular Institute and the Division of Endocrinology, obesity is unwanted weight gain and can be classified using BMI. BMI stands for Body Mass Index and takes into account your weight in kilograms and your height in meters. It also usually considers your age, sex, and sometimes race. To calculate your BMI, you would take your weight in kilograms and divide it by your height in meters squared. These are the sets of ranges and classifications for BMI. A BMI above 30 is considered to be generalized obesity, and above 40 would be extreme obesity. There are some downsides people may argue about using BMI. One of them is that if you're someone who has a lot of muscle, it can get complicated because muscle is more dense than fat, meaning it's also more heavy. And since BMI only takes into account your weight, it doesn't consider how much of that weight is body fat or muscle. Someone who is constantly active, has low body fat, and has a lot of muscle could have a high BMI and fall into the obese category, but this causes a problem because obesity is recognized as a chronic or non-transmissible disease. It happens when excess fat accumulates, which can increase the risk of developing other diseases as well. It would not make sense to say this person who is constantly active, has a low amount of body fat, and has a lot of muscle is obese. There are now more accurate ways to measure body fat, with the most accurate ones being underwater weighing, dual energy X-ray absorptiometry scanning, computed tomography, and magnetic resonance imaging. However, these could be hard to have access to, with one of the reasons being how expensive they are. Therefore, we just end up using BMI. Referring back to the paper, obesity can result from interactions between genetic characteristics in our DNA that are related to weight gain and environmental influences. And due to the psychological and social stigma of obesity, people who are obese are more vulnerable to discrimination, low self-esteem, and depression. Now, let's move on to a hormone in the body that can affect appetite control. Leptin is a protein hormone produced by adipocytes, also known as fat cells. They help send signals regarding the amount of body fat in cells and can help indicate when you're full after eating. When the fat cell mass decreases, leptin levels also decrease, which activates NPY-AGRP neurons. When there are more of these NPY-AGRP neurons being released, it makes you want to eat because your body is saying that the fat cell mass is too low and needs more from food. Leptin helps you acknowledge when you are full after eating, so if its levels decrease in your body, you will not be able to recognize when you are full. When leptin levels rise, it sends a signal for you to stop eating because your body has reached satiety. So, how exactly is leptin linked to obesity? For a person who is obese, their body became leptin resistant, which means their body does not respond to leptin like it normally should. As mentioned earlier, leptin helps alert your body when it is full so you can stop eating. If it doesn't work anymore, you won't get that feeling of satiety and will most likely continue to eat, which may lead to obesity. Lastly, we'll explain what the DASH diet is. The DASH diet stands for Dietary Approaches to Stop Hypertension. Hypertension is high blood pressure. Having high blood pressure can increase your risk in having health problems like heart disease, heart attack, and stroke. The DASH diet focuses more on vegetables, fruits, and whole grains, which are rich in potassium, calcium, magnesium, and fiber. It also limits food high in sodium, saturated fat, and added sugar. A typical American diet contains about 3,400 or more milligrams of sodium per day. The standard DASH diet limits sodium intake to 2,300 milligrams per day, and a lower sodium version of the DASH diet limits sodium intake to 1,500 milligrams per day. The FDA dietary guidelines also recommend limiting diet sodium intake to 2,300 milligrams per day, as sodium intake can play a huge role in blood pressure and other cardiovascular diseases. Here are the DASH diet's recommended servings based on a 2,000 calorie per day diet. We have 6 to 8 servings of grains, 6 or less servings of meat, poultry, or fish, 4 to 5 servings of vegetables, 4 to 5 servings of fruit, 2 to 3 servings of low-fat or fat-free dairy products, 2 to 3 servings of fats and oils. Sodium is limited to 2,300 milligrams per day, 4 to 5 servings of nuts, seeds, dry beans, and peas, and finally, 5 or less servings of sweets. So now, how is the DASH diet linked with obesity and the leptin hormone? In an obese person's body, they have a higher concentration of leptin because the amount of leptin in the body is directly proportional to the amount of body fat in the person. Having high levels of leptin can make the body less sensitive to it, which is called leptin resistance, like we described earlier. Since the body is leptin resistant, it cannot properly send the signal of fullness. Due to this, the body needs more leptin than normal to send the signal. It ends up with higher levels of leptin. The DASH diet can potentially help lower leptin levels in people who are overweight or obese. A prospective randomized study was conducted to look at the impact of the DASH diet on blood pressure, body mass, and selected biochemical parameters in overweight and obese patients. All the participants were obese or overweight with high leptin concentrations. In the DASH integrated group of the study, there was a statistically significant reduction of leptin concentrations in the results. The study also found weight loss in the results with a significant decrease of leptin and a significant correlation between the BMI and leptin concentration changes. There was also an animal study performed on lean and obese mice. The research team observed the leptin levels of lean mice and mice who became obese from high-fat diets. The obese mice were leptin resistant, but by decreasing the fat content in the diets, their leptin responsiveness recovered. This study relates to the DASH diet because one of the goals the diet promotes is to decrease saturated fat intake. Also, the diet specifically recommends low-fat or fat-free dairy products to minimize the amount of fat in the diet. As the study's results show that decreasing the fat content in the obese mice's diets can help restore leptin sensitivity in them, the DASH diet may be able to help obese individuals restore their leptin sensitivity as well. When their leptin sensitivity begins to get restored, they may start to notice getting full more often and eat less. This could lead to weight loss to help treat obesity. Thanks for watching. I hope you were able to take something away from this video